A new program is providing free cancer screenings in southern Utah. In the sponsored interview, we have Dr. Grant Sonata, San Juan County Public Health Director, and registered nurse Bridget Horrocks with the Monticello Cancer Screening Program. And we're talking about a very important program that can save lives. And Doctor, I want to start with you to give us some history of why we are doing this, why this is important, and we have some federal funding.
Well, this is unique because there was a government-run uranium mill during World War II and for a few decades after. And it was a unique time when the area was really proud to support the efforts during that atomic era. But the problem was the science at the time didn't have good protections in place for the community. And so uranium mill tailings were blowing across the town and used in different ways across the town. But thankfully it was cleaned up by 2002. But it's everyone that lived, worked, or went to school before then for at least 3 years that we want them to contact us and get a free cancer screening.
And I want to turn to you, registered nurse Bridget. You are behind coordinating this program of free cancer screenings. And you also have a personal story because your family lived right next to this mill.
Yes, I raised my four children right next to where the mine was cleaned up. And I've been there since the early 90s. And so it's really important to me that I reach out to everyone and get these screenings.
This is your passion. I can hear in your voice the heart of this program. What types of screenings can we expect? What are you looking for?
Well, we have a lot of cancers that were linked from what we have from research. There may be others out there, but at this point, some of the stronger ones were pulmonary, so lung, and esophageal, renal, and things like leukemias. We want the doctors to do thorough examinations, and so that we can make sure that everybody's at a safer.
Right.
And so when we go through this screening process, what do people have to do when they walk into this clinic?
So if they walk into the clinic, they would present a voucher. First, they would apply for or fill out an application, and then we would give the voucher. They would take it to their preferred provider. And then the voucher will be sent to billing, and then we cover the cost of any deductibles, out of pocket, anything related to cancer screening that the patients don't have to pay.
And so they have peace of mind that the government is taking care of them and the screenings are taken care of, no financial burden. And doctor, have we seen these cancers pretty rampant, the period that you're talking about and the ramifications of having this uranium mill?
Yeah, the inspiring part for me is that knowing that the community has really come together over the decades, recognizing there was something unusual happening. And they came together and were able to advocate to government representatives and get this funding and get the cleanup taken care of, because it is safe now. That is something we want everyone to know, that it is a great place to come visit, to live and work. But now we have this available for those people that, again, lived, worked, or went to school before 2002.
Well, that federal backing is really important to make sure that we are keeping and continuing to keep our families safe who lived in that time period. And so it is personalized care. You want to make sure they're taken care of. Someone out there who's listening and says, well, I lived during that time period, it wasn't quite cleaned up, or during the cleanup, what should they do?
So they can contact our website at Public Health or call our public health phone number. And then I would be able to work them or navigate them through the process to get their application.
So do they make an appointment? Do they have to have insurance?
They don't have to have insurance. We want to make sure that everybody gets their screenings. But they don't have to make an appointment. They can just call and we'll work them through the process and get them their application, their voucher, and get them ready to go.
Do they have to have symptoms, or is it for people who say, you know what, I lived during that time, but I don't have any symptoms, so maybe I don't need to make an appointment or need to call? but you still want them to?
Yes, I think it's really important that everybody, just for that early detection, just in case. Some people they go in and don't have symptoms, and so just on the precaution and the safety side of it, go get screened. Yes,
they may have had cancer before, and it's good to check on maybe a different type of cancer, or maybe been screened before, and it's good to check again.
And bottom line, this will save lives.
It's
yes.
so true. Early detection, that's what gives us hope, and we hear it from the community all the time. Early detection saves lives.
Because a lot of times there are no symptoms for these types of cancers. So thank you so much for this public service announcement to let people know that there are life-saving measures and screenings, and early detection is key. Thanks again to San Juan County Public Health for sponsoring this interview. Now.